Good afternoon. Thank you for coming. I'm Mary Briggs, the System Director for Strategic Communications here at Lee Health. Appreciate your attendance and everything that you're doing to spread the news about the COVID-19 surge that's happening in our community. You will hear from Dr. Antonucci this morning and from Dr. Stovall. You'll also hear from Dr. Taillon, who's a critical care physician here. We'll make some remarks, and then we will stick around for some one-on-ones afterwards, and we'll have some Q&A as well. Dr. Antonucci.
Thanks, Mary, and thank you all for being here today. I was hoping to share better news with you this week, but unfortunately, the community is still in crisis. We have 641 patients with COVID in our hospitals, which is an all-time high. Our peak last year topped out at 372, so you can get an idea of where we are compared to last year's peak. And of those patients, 103 are in the intensive care unit, again, a record, and 84 are on ventilators. All those are record numbers that we have not seen in the past. In addition, sadly, we have 12 patients at Golisano Children's Hospital. And as I've said before, during our prior peaks, we never really had more than 1 or 2 children in the hospital. So this is a significant change for us and something that worries us greatly. In fact, if you look at our ED volumes, yesterday we had over 1,100 patients come to our EDs, and about half of them had COVID patients. Similarly, at Golisano Children's Hospital, where we have a separate pediatric emergency department, we had 265 children show up, and 135 had COVID-19 symptoms. Again, it gives you a perspective of the magnitude of the challenge that we're facing. Our hospitals are 98% full. Our ICUs are 96% full. Yesterday we had 84 admissions with COVID. That means 84 patients with COVID were admitted to the hospital. We were able to discharge 67, but we're still seeing a net increase every day, as you can see. Sadly, we've lost 847 patients with COVID in our facilities, and 6 just yesterday, and our hearts go out to those families. We are working to improve testing. One of the things that we've had a challenge with over these past few weeks is getting COVID testing done. So we're working in a partnership with a company called Curative, and we're adding testing sites here in Fort Myers and Cape Coral. The one at Page Field is a drive-through site. You can get appointments at curative.com. And yesterday we did 500 tests at that site. And we'll be adding one on Pine Island Road today. So we're asking those patients who need to be tested to please go to these sites and not come to the emergency room unless you have a true emergency. If you're having trouble breathing or having severe difficulties, go to the ER. But if not, if you just want testing, please go to these sites. In addition, later on today at 2 o'clock, Dr. Stovall and I will be doing a Facebook Live for the community to allow members of our community to ask us any questions that they may have about COVID. And we're going to be doing that because it's so important. People have questions. There is so much misinformation out there. We want to be able to provide really top-notch expert advice on what COVID is and what we can do about it. And it's called What You Need to Know, COVID-19 Update. And it will be interactive, as I said. So I encourage anyone to participate in this. It will be open to anyone in the public just by going to our Facebook page. So at this point, I'd like to introduce Dr. Stovall, who will give you a further update. Stephanie?
Thanks, Dr. Antonucci, and thank you all for coming today. We appreciate you taking your time out of your day and appreciate your efforts to help us get out important health information that we'd like to share with our community. Today, my message is primarily about vaccines. There's been news about vaccines in the last week or two, and so we want to work to be sure that we're giving you the right information. There's a lot of misinformation out there, and so I'm going to use this opportunity to just set a few things straight. We do know that vaccines save lives. Vaccines save hospitalizations. They keep people healthy, even if they happen to get breakthrough infection with COVID-19. Breakthrough does happen. The vast majority of patients who have breakthrough infections, meaning they're fully vaccinated before they're infected with the virus, have mild symptoms. Most of them don't even have to be in the hospital. And even if they are in the hospital, they're usually not as sick as the unvaccinated. That's been our experience and the experience of other healthcare providers throughout the United States. The vaccines have been rigorously tested. As most of you are aware, the Pfizer-BioNTech vaccine has now received full FDA approval. It's the first vaccine for COVID-19 that has received full FDA approval. It wasn't really a result of additional testing. It was a result of going through the entire process to be FDA approved, and it was approved down to age 16 plus. If you all remember when Pfizer-BioNTech COVID vaccine was first available, the initial EUA was down to that age. We expect that the labeling will continue to decrease in age just as we have seen the EUA. Children between ages 12 and 16 can still be vaccinated according to the EUA, which is still in place for those age groups. Moderna is also still available and is a similar vaccine and has similar efficacy to the Pfizer vaccine. And J&J is a little bit different. It's not an mRNA vaccine. However, both methodologies for vaccines have been tested for decades in the United States and have successfully produced immunity for the diseases that they're used for. For getting vaccines, the other thing that has come forward is boosters. So in the last couple of weeks, we've heard lots of things about boosters. The first booster recommendation is for immune-compromised individuals. If you need a list of those, we can make those available on our websites, but basically it's for people that we know aren't going to have a great response to the vaccine or they're unlikely to have. So those individuals can get a third booster after they have been fully vaccinated with either Pfizer or Moderna. We do want to match the vaccine, so if you receive Pfizer the first time, you receive Pfizer for the third dose. Likewise for Moderna. Additional information about boosters is expected in the next few weeks. Many of you know that the HHS has recommended that, and the ACIP will be looking at that in the next week or two, so hopefully we'll have more information at that time. What we've done at Lee Health to try to protect our community is increase access to vaccines. So it's available through our walk-in clinic or through scheduling an appointment through our clinic at Gulf Coast Medical Center, just as it has been for many months. We are adding back an additional day. So previously we were on Tuesdays and Fridays from 7 to 3:30. Now that will also be available on Wednesdays. We'll add additional days as we need to. We're definitely seeing an increased uptake, and we appreciate your efforts at trying to get the word out there. So the message for today is vaccines save lives. Please go get your vaccine if you're eligible so that you can protect yourself and those around you. I'm going to turn it over now for Dr. Taillon, who's going to talk to you. He's a pulmonary and critical care specialist. He's going to give you an idea of what he's seeing in our ICUs.
Good afternoon. So my name is Jordan Taillon. I'm a pulmonary and critical care physician with Lee Health, and I was asked to share my experiences in the ICUs with this recent surge. So I was racking my brain trying to come up with a way to truly express what it's been like in the ICUs recently. I think the best word that I was able to come up with this most recent experience is heartbreaking. Our ICUs right now are overrun with COVID-19. We have patients overflowing into the ED and other makeshift ICU floors. You know, the beginning of this pandemic was a time of uncertainty, and the initial surge definitely tested our limits. This recent surge, however, has been different. The biggest difference that I have noticed is the age of our patients that we are seeing. The first big wave, when it hit, it was mainly older people with many comorbidities. That is no longer the case. In the past few weeks, I have had to intubate numerous people under the age of 40, and even some people under the age of 30. And these are not unhealthy people. They do not have the comorbidities that we initially were seeing. Watching these people deteriorate and in many instances die, when it likely could have been prevented, is heart-wrenching and something that is not easily pushed aside. Many of these patients regret having not gotten the vaccine and now look to medicine for a cure when the preventative measure was there the entire time. The ICU staffs are emotionally and physically exhausted. They have worked extra shifts, they've taken times away from their families to combat COVID-19. While they prove again and again the strength of human spirit, their resiliency in times of crisis, and their compassion and empathy for other humans, this current surge has really taken its toll on all of us. We are tired and we're stretched to our limits. While we have seen some patients with the vaccine in the ICU, from my personal experiences, these patients have for the most part gotten better and leave the ICU. We have seen that with the vaccine, obviously you can still get COVID, but it will not be as severe. I became a doctor because I wanted to help people, and I became an ICU physician because I wanted to save lives. Getting this message out to everyone about the seriousness of the situation and how the vaccine can save lives is currently my most important message. If you have not gotten your vaccine, now is definitely the time to get it. Thank you.
All right, so we'll take a few questions now. Who wants to start? Yeah.
First, Dr. Antonucci mentioned earlier about combating some of the misinformation. I was hoping you could touch on sort of some of the biggest pieces of misinformation you all hear and address those.
Yeah, I mean, there's so much out there. The vaccine doesn't work because we're seeing some unvaccinated people come in with COVID. There's tweets out there that it doesn't work. There's a lot of misinformation about therapies, whether it's ivermectin or whether it's hydroxychloroquine. Those persist even though the data just isn't there to support their use right now. It's not to say it might not show up in the future, but as it stands right now, those are not therapies that work. There was somebody posted something on my Twitter account about vaccines, that's how they track you. And, again, just nonsense things that are out there. And we're doing everything we can to combat it. And the fact of the matter is, we know that you're better off getting the vaccine than not getting the vaccine. And we know what the effects of COVID are. And we know how serious it is. And as we just heard, we're seeing younger and younger people that are otherwise healthy succumbing to this virus, and it is heartbreaking. It's heartbreaking to see, and it's heartbreaking to be part of this team. So I just can't say enough about what this team has done to take care of patients day in and day out, especially when they're seeing patients who otherwise should be thriving today who are not.
And sir, for you, you mentioned Twitter. You and your staff, between the internet and the press conferences, you spend a lot of energy trying to get the word out. When you see a tweet like that, how frustrating is it for you and your staff?
Well, it's terribly frustrating, and you debate long and hard whether you even respond to things like that. I chose not to respond. Probably was smarter not to respond. But yeah, when you see that stuff out there, it really breaks your heart, and you just want to take people like that and say, come with me to the ICU. Let me show you, what you're talking about. We can't do that, of course, but one of the biggest roles I have through this pandemic is education and support, and that's why I'm doing the press conferences. I'm available, as you all know. If you call, I'll be there, and I will do everything I can to get the word out.
More than 270 doctors in Lee County have signed a petition calling for the Lee County School Board to address a new mask mandate that would remove the opt-out. Can you talk about your stance on that?
Well, from the very beginning, we've supported the CDC and the American Academy of Pediatrics recommendation to wear masks. So we've said that from day one.
Since Pfizer got the FDA approval, are you guys expecting or hoping for a mad dash of people coming in for vaccinations?
Well, I don't know about a mad dash, but we are anticipating that more people will get vaccinated. We're certainly hoping that that's the case. The whole narrative out there that this is, quote, an experimental vaccine is really untrue. The vaccine is tested as much as any other vaccine has ever been tested. But now that it's fully approved, that argument is off the table. So we are hoping that we're going to see more and more people show up for vaccinations.
A message to parents who have young children that are not eligible for the vaccine. Can you talk about ways that they can protect their children? Because a couple parents today who are in the ICU with children as young as 3 months are really struggling right now. And we're talking about the vulnerable population, which is obviously now drawn to children.
We're very concerned about our children, and the things that we recommend have been the same things that we've recommended since the very beginning of the pandemic for those who can't be vaccinated, and that's wearing masks, social distancing, frequent hand washing, and the things to avoid, because we know viruses don't have legs. They can't walk from one patient to another. They have to be transmitted, and if we can stop that transmission, we can protect the children along with everyone else. Any other questions? Well, again, we sincerely appreciate you being here and the work that you've done in partnership with us to communicate to the public. It's made an enormous difference, and we don't feel like we're just a voice in the wilderness. So thanks again, and we'll see you next week, and I hope and pray that the news will be better.